Aloha kakaya kakako. Good morning and welcome to Hawaii Care Choices Healthcare Talk Story. I'm Tish Lopez, your moderator this morning. Happy, beautiful Aloha Monday and happy Merry Monarch Week. Just a friendly reminder, today's talk story is being recorded so that you and others may access it in the future. All of our presentations are available on our YouTube channel simply by searching Hawaii Care Choices. We are now on Facebook, Instagram, and Twitter. Please follow us to see lots of content, upcoming events, get to know our team and the supportive community members and your patient stories. If you follow us, please send Lonnie and I a comment or a heart or even a shaka. We would love to see you and connect with you all. Just wanted to let everybody know, in celebration of Merry Monarch Week, Hawaii Care Choices will have its very own float in the parade. This Saturday, April 15th, we are celebrating 40 years of compassionate care, and we cannot wait to see you all. Follow us on Instagram or Facebook to see all the inside details. All right, back to our regular scheduled Zoom. For those of you joining us on Zoom, the bottom of your screen should look like this. Please follow the green arrow and click on the chat box to say aloha and let us know where you're joining in from. Today's Healthcare Talk Story will be diving in and discussing how to boost quality of life for caregivers and veterans living with serious illness. You may ask questions throughout the presentation following the purple arrow, clicking on the Q&A box at any time to submit your questions to our panelists. To those of you watching on Facebook Live, mahalo for joining us and aloha. Please use your comment box to say aloha and let us know where you are joining in from. Feel free to chat in your questions as well as share your reactions with us during the talk story using those reaction buttons. We love to see the hearts, thumbs up, the care button. Also, feel free to share this live video to your friends. We are also doing polls today. So for those of you watching on Facebook Live, you will not see the polls pop up, but we want to hear from you using the comment box. Everyone is welcome in the fully engaged Zoom presentation next month. Just email me, lopez@hawaiicarechoices.org, and I will send you the link. So polling is very simple, and many of you may have done it before. A brain teaser bell will ring. A question will pop up similar to what you see on the screen. Please make the selection you think is best next to the orange arrow and submit your polling on the bottom next to the green arrow. So just to kick things off and get everybody comfortable, I am going to do a quick icebreaker. All right, so the question up on your screen is, if you were a dog, which dog would you be? Miniature Frenchie, a pit bull, husky, or a boy dog? Feel free to put your answer in and click submit. It's super duper easy. I hope everybody had their coffee this morning. I was very energized by Hawaiian music this morning. It is just, 'tis the season, right? All right, I'm going to go ahead and the polling right there and share the results. So 25% of you said miniature Frenchie, 25% of you said pit bull, and 50% of you said husky. Awesome job, everyone. Simple, simple, and so thankful for you to engage in our polls. Moving right along. Oh, how am I? I'm also doing our IT. So sometimes I may have to go back and forth to two screens, just how it is. All right, our special guest I'd love to introduce to you guys this morning, Maricar Souza, Veteran Outreach Specialist at Hilo Veterans Center, doing amazing work providing counseling for combat veterans. Please give a warm virtual welcome for Maricar. Aloha, Maricar. This morning, we also have Lonnie Weigert, who is also always the hostess with the mostest. Please give a warm virtual welcome to Lonnie. Aloha, Lonnie.
Aloha, everyone. Thank you for joining us.
This morning, Lonnie will talk stories about palliative care, and Maricar will take us behind the scenes to learn how she helps veterans living with serious illness. I am so excited for you all to be here today on our Healthcare Talk story. I'd like to just jump in by asking Maricar. Maricar, can you please tell us a little bit more about what you do and how long you've been doing it?
My name is Maricar Souza. So a little bit of background is I'm a combat veteran myself. So I did serve a total of 26 years in the military. 6 of that was active duty, and the rest of it was at Army Reserves. But with them, I deployed once to Iraq and once to Kuwait. So a total of 2 years in the desert, in the wartime zone. But that was total 3 years away from my family. I retired in 2016, so I don't actually collect my benefits until the age of 60. But in the meantime, I've been working with the Hilo Vet Center and Kona Vet Center as the veteran outreach specialist. So our main focus is that even though we are part of the Department of Veterans Affairs, we do provide readjustment counseling for combat veterans and their families before, during, and after any wartime period. So we have 3 counselors. The minimum degree they have to have is a master's in social work. They do the basic counseling as far as helping veterans to do the transition from combat life to regular civilian life, because now there's a new norm. You know, being a combat veteran, the experience may be different for everybody. I didn't see combat myself, but I was getting shot at. So even though we may not have to, you know, be there shooting the guns or you know, receiving direct fire, we were still in imminent danger. So I can relate to that combat vet. So for my job, I'm just the outreach person. So I can help with everything else. So once a month, or on Mondays, I do a benefits brief. So I can go over what the 3 branches of the VA is, because there is healthcare, there's the benefits, there's the state VA, there's veteran service organizations. So just deciphering, you know, who to call in the VA. Like, people don't know that we're just RCS, Readjustment Counseling Services. They say, but you are the VA. And I'll tell them, like, hey, I don't have the letters VA tattooed on my forehead. I'm not the VA. So, but I can help you to figure out what is it you need or what is it that you want. So if they come in and they say, you know, like this morning, I have my brother who he has to come home from the Veterans Care home, but I don't know what to do with him. I can care for him, but he has, you know, mental and physical injuries. And what did I do? I gave him your guys' card. So I said, hey, you know, talk to you guys. So I'm like the buffer to say, hey, if you're homeless, this is where you go. If you need financial, this is where you go. If you're a combat vet, then you can stop here and talk to us. So basically, I'm everywhere. So I will be at the Mary Monarch from the 12th to the 15th, right at the Butler building, at the entrance, providing education for the whole community. So sometimes I get veterans who are visiting from another state, and they just have basic questions like, you know, what do I do with my military retirement? And so there's many benefits that come with just being in the military. Doesn't have to be combat related injuries. For women, we find that there's a lot of either sexual harassment or military sexual trauma. So the media has covered us as women vets and said that, hey, there is a problem in the military that, you know, it's not the same as being a victim in the civilian world. There's too much red tape to go through just to advocate for victims. So that is something that we have to learn, that just because we're women vets, we walk into the VA clinic, they said, where's your husband? It's like, wait, I'm the veteran here. So just taking away that stigma that veterans are not just men, they're women. And I do host a Women's Veterans Day event. So that's something that I do promote and say, hey, we're here for each other. So I can kind of relate on both aspects because I am a combat vet. I work with veterans, I work with families. So I can kind of help to say, hey, what is it that you need? Let's talk stories. There's Vala'au.
Maricar, that is amazing. First of all, I just want to say thank you so much for your service. And then coming back and just giving back to your community and being there for the women, but also for the veterans as a whole. So thank you so much. I am going to give it back over to Lonnie for understanding palliative care.
Awesome. Thank you so much, Tish. Oh my gosh, Maricar, how would we ever know that you do so much? I'm really, really, really honored that you was able to make time to come and share with us on here, because there are so many people that don't realize that there's a resource like you right here in Hilo. And you've been so gracious to us as well to have Valerie come and speak to the vets and their spouses on Mondays, because prior to that, it was like trying to break into the fortress, of getting to the vets just to try to help them. But because of you, Maricar, I mean, there's some positive difference that's happening, and I'm really, really grateful for you. So I'm going to tell everybody a little bit about palliative care, but we have a lot of questions, Maricar, for you that we're interested in finding out where your vets are getting access to care and what kind of care they're getting. And so let me just tell everybody a little bit about this palliative care. You probably hear Valerie share that, every week, but a lot of people actually don't even know what it means, palliative care. And for the most part, it's a very specialized type of care. It really focuses on the relief, and we try our best to just boost that quality of life for whoever is dealing with a serious illness. And a lot of times people don't realize that they can get palliative care at any age. So even babies can receive palliative care too. And for the most part, to palliate means to ease, to alleviate, to relieve and soothe. And that's why it's a specially type of care, because it comes, palliative care is normally something that we will come in on because a patient is dealing with a very serious illness, and because they're doing treatments, they have a lot of discomfort. Probably most of it is pain, but a lot of it is emotional stress as well. And that's why we come in to really focus on that part of the care for them.
Mark, I did want to ask, does the VA offer care, or excuse me, palliative care in their standard medical benefits to veterans and their families?
Once the veteran applies for VA medical, then it all depends on what priority group they're in. So they may have to pay a copay, their payments might be free, but once they get assigned a primary care physician, this is just for the veterans, then they can get specialty care. So whether it's mental health, physical, seeing the foot doctor, the eye doctor, then the primary care physician can do that. If not, then they can call what is called care in the community, and they can help to find a specialty doctor. So if the veteran's family is eligible for CHAMP VA, because they're 100% service connected, then CHAMP VA would then help them with finding a doctor in the community.
Wonderful. Thank you so much for that resource. Back to you, Lani.
Thank you. So Maricar, can you tell us a little bit about what is care in the community? Like who runs that, and how do people get access to that? The veterans I'm talking about.
It used to be TRICARE, so
okay.
to be subcontracted by the VA to help facilitate appointments for veterans. But now they have VA employees who do that in the VA Island Healthcare System. So the main facility for all the clinics is at Sparks Matsunaga. So they're called Care in the Community, also known as SITSI. So if you was to call the 1-800-214-1306, then they will then try to find you that specialty doctor. So they basically are the ones to find the veterans the care that they need in the community. That's why they're calling them SITSI. So no longer is TRICARE involved, maybe for some billing, but it's kind of like they change contractors. So VA is very complicated, but the thing to get from that is that if veterans call their primary care physician, they'll find them everything they need. If they call SITSI, then they can help find, like I said, the specialty doctor.
How are the veterans assigned a primary care physician? Is it always a physician that's on this island?
Well, the Hilo and Kona clinics have at least 3 or 4 primary care physicians. So I do believe we lost a doctor, but we gained a female doctor. So everybody assigned that general practitioner. So that doctor only does the basic stuff. So if they have to refer to specialty like gastrointestinal or occupational therapy, they'll refer it for authorization, and they'll find somebody in the community who will take the VA medical, and they can see that person. So CITSI will take over, find that doctor, and then see what appointment best suits the veteran. So the veteran will say, yes, I'm available only on Thursdays after 1, and then they'll find that appointment for the veteran. So it's not instant. Of course, you have to go through the steps. Unless it's an emergency, then they would have to use either urgent care or call 911 or go to the emergency room. Then the veterans will notify the VA that they were being cared for other than the VA, so the VA can pay for it. So a lot of that, the veterans don't know. So that's what I do during my brief is I say, hey, if you did go to the ER, then within 72 hours, let the emergency care notification know so that the VA can be billed. If not, make sure that Hilo Hospital Urgent Care has the VA information so they can be billed. Because if they have other insurance, they're going to expect the other insurance to be paid, whoever pays first. So that's why I let veterans know what their options are. Because we don't have a VA hospital in the state of Hawaii, it's only clinics. So then the VA clinic only opens, 8 to 4 or 5. So that's kind of hard when you're trying to find care afterwards. So as long as they know the process and how to get help in the community and work around the VA's time, then it'll be easier for the veterans to understand. But if they don't, that's where I come in. I can explain to them, yes, because it's not 24 hours, it's like any regular doctor. Like if you had a pediatrician, don't expect the pediatrician to be open on the weekends. So it's the same thing here. We only have clinics. We don't have a hospital. So that's why they only have regular office hours.
Wow. So Maricar, you're really a one-man band, which is just amazing. Is there any chance of you putting us in contact with CITSI and the Hilo providers so we can,
Yes,
update them?
I have that all in my Hilo brochure. It's one trifold, front and back. In the middle, it just has to do with medical. On the right-hand side, it benefits. On the left-hand side is veteran service groups. And in the front, the very front of the brochure is us. So if they call us, then we can explain to them, hey, this is the contact numbers. I even have military contacts in there, casualty assistance, insurance, all the numbers that they need to figure out where to go. So the main number for the VA Pacific Island Healthcare Systems number is a 1-800-214-1306. That number is 24 hours. So even if they call on a Saturday night and they was to get a hold of the telephone advice nurse, that person will then refer them to who they need. If you call the vet center, we have it on the 24-hour suicide hotline. So that is basically the call center for the for readjustment. And what that does is first they're going to ask, hey, are you suicidal? What is the emergency? And if they say it's not an emergency, they'll email us to say, hey, a veteran called and they called after hours and missed their appointment on Friday. So we follow up on Monday. So if they call us, it's just going to go to the national call center. Whereas if you call the VA, the 214-1306, that is for healthcare. So that is the one that has to do anything to do with emergency or non-emergency.
Thank you. Thank you, Maricar. So I'm going to just continue right now on the benefits of palliative care. So a lot of times people will say, number one, they don't even understand what palliative care is, which is why I explained to you that it is a specialty type of care. And the key is really early admission. For people that are living with serious illness such as cancer, there may be treatments that are inappropriate for them, but they won't know unless they're already part of a palliative care team. And I'll give you an example of that. When we had a doctor, a very young doctor, she was 21 years old. In fact, she was going to school to become a doctor. She was diagnosed with cervical cancer. And immediately the primary care physician scheduled her for surgery. So this is the thing that everybody needs to understand, is that for palliative care, the primary care physician or any of the physicians, their goal is to cure that illness. For palliative care team, it's all about focusing on the patient and all the needs of the patients based on their values and their life goals. So what ended up happening is that the doctor scheduled the patient for surgery, and then she happened to come across a palliative care social worker who then immediately asked her, what is your life goals? And in that conversation, it was discovered that surgery would probably result in the patient never going and doing the things that she loves. One of the top things for her was she was an avid cyclist. She went into marathons. She was often in races. It was something that really brought her joy. And in finding out further about what the result would be for her surgery, it came down to that she would probably never cycle again. So this is why I say that without coming in early to palliative care, no matter who you are, especially veterans, I always think to myself, if there's any way that we can get this type of information to those who are serving vets, it would really be wonderful to connect them to that care as early as possible, and even their family members as well. So this is something that a lot of people don't realize, that there is a real different role that we're all playing when it comes to palliative care. Primary care physician, always focusing on the curative treatment, and palliative care team is always focusing on the life goals and the values of the patient. So it's really important to understand too that palliative care, when the team comes into the home, they're not it's not a hands-on type of care. They're not doing wound care or any type of hands-on care. They're really coming in to educate the patient and the family on things that will help them feel better. And that is so important, because a lot of times they wouldn't have to just go straight to urgent care or call 911 and take the ambulance to the emergency room if they simply knew a few of the easy steps that they could do just so that they could ease their anxiety. And I have to tell you, 90% of the time that they're heading to emergency room is because of anxiety, and the palliative care team can take care of that for them.
Maricar, can you tell us a little bit more about the VA concurrent care for vets living with advanced illness?
What does that mean, concurrent care?
Oh,
Let me go back.
So Maricar, concurrent care is it's where a veteran can receive all the benefits that hospice gives, but they can still do their treatments. So it's something super specialized and unique, specifically for veterans. I don't know if you've come across any veteran that has had.
I did hear that Valerie mentioned that you guys do that. So you are connected with the VA. So because the VA has the primary care physicians, we do have the social worker, Kevin Iwasaki, but we also have a geriatric social worker. So anybody who's elderly would then have a special social worker. So within the VA clinic, they have different social workers who can go out in a community or like help with everything as far as the social aspect. So I think that's where that comes in. So anytime a veteran has a medical need, like they need to modify their home, I send them to Kevin because he is their social worker for all the 4 doctors. And I'm not sure who the geriatric was. I remember it was Anne. And then there's also a homeless team. So the homeless team, they will help figure out benefits for the homeless vet. That's why when you go to any VA appointment, the first question asked is, what is your pain level? And the next one is, are you homeless? So then they'll refer directly within the clinic to get that benefits on the healthcare side. The benefit side, because they're separate, they may mention on the benefit side, yes, they can get aid in attendance. That's extra money to hire somebody to care for them, either in a nursing home or within the home. So if there's like a loss of pay because a loved one or the spouse had to stay home to watch the vet, that extra $1,000 a month on their check does help supplement that loss of pay. So that's on the benefit side. So I'm not sure if the healthcare side is promoting this, but I'm pretty sure that Kevin and their team is the ones that's doing it, not the main doctors. The main doctors is just there to say, hey, this is your pain and I'm going to help you get rid of that pain. Or if you need to see a mental health, then I'll refer you. So basically, that primary care physician is kind of like the middle person to get them what they need.
Awesome. Thank you.
Thank you so much, Maricar. Now it's time for our brain teaser. So we have a brain teaser up on your screen. The question is, early patient sign up ensures more support and quality of life for all, true or false? Thank you so much for those who are watching on Facebook Live. Unfortunately, you are not be able to see the post pop up, but we still want to hear from you. So the question is, early patient sign up ensures more support and quality of life for all. Please feel free to put true or false right there in that comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month. You can feel free to email me, lopez@hawaiicarechoices.org, or visit www.hawaiicarechoices.org/healthcare talk story. All right, I'm going to end the poll right here and share the results. 100% of you said true. Early patient sign-up ensures more support and quality of life for all. Thank you so much for that. Absolutely ensures more support and quality of life for all. Back to you, Lonnie.
Thank you. So I'm just sharing with everyone, these are the current diagnoses that we are able to come in and help with palliative care. And so you see them listed right here on your screen. Basically, our focus is on trying to boost their quality of life, because normally when they're living with these types of serious illnesses, they are very uncomfortable, largely if they're getting any kind of treatments, any kind of chemotherapy, radiation, etc. They have a really tough time staying comfortable. And so we come on in and we help the patient, but really, we're really there a lot for the caregiver and the families, because a lot of the anxiety isn't just held by the patient alone. It's definitely a good portion of that is held by the caregiver and families too. And so when we come in, we really want to educate everyone so that they can kind of bring it down a little bit and realize, we got this, and give them the confidence to get through the next day, the next week, the next years.
Absolutely. Thank you so much, Lonnie. Maricar, I know you mentioned it a little bit, and we want to know, how do vets access their health care? You mentioning the brochure and all of the people that they can call. How else can they access their health care, and where can they access it from?
Well, we have a online, it's called My Healthy Vet. What that does, it shows like all of their future appointments, some of their lab results. That's where they can turn in their travel vouchers. And it does have a lot of information on there. And they have a place where you can get a hold of a My Healthy Vet person. But as far as the main number, the 1-800-214-1306, that is where they can get a hold of their primary care physician, either at the Hilo or Kona clinic, or help answer any questions about billing or specialty care and so forth. If they want to get a hold of their doctor directly, then the Hilo number is the 935-3781, and the Kona is the 329-0774. So if they have a telephone book, or if they have like an internet, they can find those numbers. But like I said, we have the brochure, which we can, if they call, a lot of times they're just asking for the VA clinics number, we'll give it to them directly. So our number is the 969-3833. So if they call us, we have somebody answer, we're supposed to answer within 2 rings. On your end, it might seem like 3 or 4 rings, but we tried it many times and we only hear 2 rings before we actually have to pick it up. If it rings more than 3 times, somebody's scrambling to grab the phone. So we are a person that you can talk to live. You don't have that where if you call the 214 or the 935 number, it's going to be press 1 for this, 2 for that, 3 for this. And by the time they go to the voice prompts, they're like, I pressed the wrong one and I couldn't go to my doctor. So they call us and I say, you know what? I'll go email Kevin or I'll email your doctor because I'm on Outlook. I've even had veterans say, you know, I just want to complain and say how bad this clinic is, even though most of the time people won't say how good they are. But when something is bad, of course, they want it to change right away. So that's when you hear a lot of the bad stuff. So what I do is I'll give them, I say, well, how high up do you want to go? You want to complain to the president of the United States or the VA secretary, or you want to start from the bottom up? Where do you want to go? So they say, I just want to complain to the state, the senators. I say, okay, here's a list of all the senators. You can email them. But then if you want to start from the bottom, we can go with the VA patient advocate, go through Kevin, go directly to the 214-1306. That's where the advocates are. And then they can get a hold of the VA director for the state of Hawaii if they want to just go up to that point. So our chain of command is very small here at the Vet Center. It's myself, my director. She answers to our Region 5, who then answers to, what is his name? Mike Fisher, who answers to the VA secretary and then to the president. So it's a very short chain of command as far as us. If they want to make a complaint, I'm like, by all means, you can, because later on, the veterans will come in and say, you know what, I really had a bad day that day. I'm sorry for yelling at you. It was just me. And we've learned how to communicate that way. So we try to listen and hear what they have to say first before we try to jump in and try to solve the problem, because sometimes they just want to vent. And that's a good thing, because that's what we're here for. We're here for counseling. So by the time they're done and say, well, you didn't help me. It's like, well, what you was asking was not in our department. It had to do with driver's licensing or something like that. So yeah, we're not able to help you, but we gave you the information to get that, word veteran on your license plate. So that is where we can help them navigate anything else that they need, whether it's their military ID, trying to get their retirement benefits, trying to get a hold of their military pay. We have all the resources. Because we're mostly combat veterans ourselves here, we can relate to them. So we've kind of, used the benefits ourselves. So we went through it ourselves, especially for me. I'm on the Reserve, National Guard, and that's what we have on island. I've also done active duty. So anybody who comes in, just getting out of military, I can say, hey, these are your benefits after getting out, or while you're still in, these are your benefits. So I went to the Youth Challenge Career Fair, and the first thing they asked is, what do you like about your job? I was like, the benefits. I mean, I have a federal job. It comes with benefits, and I always promote that it's a good place to work. It's a stable paycheck. Even through COVID, we're still open. So even just letting them know that it's a career, just working with veterans or part of the government, is not just, I don't want to work for the government. They screwed me over. It's like, wait a minute. If you work in the government, then you can find out what it is that the government does. And it's usually just people working with other people. It's not this scary thing. So just because we're a government facility, we're still open to anybody who walks in. So that is where we want to feel that they can be comfortable. Is, hey, I want to ask this question. It sounds like a stupid question. It's like, no, question is stupid. Just ask it, because we can help you figure out what the answer is.
Maricar, that was so wonderful. Here at Healthcare Talk Story, we talk about a lot of the healthcare, but then also as Hawaii Care Choices, we look at the whole person, right? Treating the entire person. And I love your stories that you have shared. And it's really taking in that veteran and caring for them entirely, right? Whether it is driver's license or getting the veteran's, name on their plate, or actually accessing healthcare, you guys do it all. I'm so amazed, and I'm so thankful that you are on here to share that with everyone. We have Roxanne Rove, who chatted in. She wanted to add that the VA has 4 primary care providers, 3 MD, 1 APRN for primary care. You guys will also be adding another MD this month. Kevin is a primary care licensed clinical social worker. There's also a PharmD for clinical management of medical conditions. There is also a mental health team comprised of a psychologist, psychiatrist, LCSW for therapy, HUD-VASH, for homeless, and MHICM for outreach of severely mentally ill. We also have home-based primary care, which includes APRN, RN, licensed clinical social worker, OT, PharmD, dietitian, psychology, and psychiatry. That is amazing. Thank you so much, Roxanne, for sharing all of the entirety of your healthcare access as well. So thank you for that. All right, Lonnie, back to you.
Thank you. I'm so glad we're recording this, because this will become a resource for other vets who come across us, or that we come across them. We'll be able to let them know to come to our YouTube channel and go ahead and watch this, because there's so much information that we have received just in the last 30 minutes. So thank you, really, thank you a lot. I appreciate it so much. Mahalo to you as well, Roxanne. So on the palliative care side, I just want you to know that when people come to us, they're normally in distress of some type, and it's really about us trying to get in there and controlling their pain. So once we connect with them, we really want to know what their life goals are, so that we can create a goals of care plan for them. And then once we're able to do that, then we are able to help them manage their pain and provide them emotional support. Because like I told you that, oftentimes once a patient hears that they have cancer, they often don't hear anything else that is said to them after that. And so we try to come in and educate them about their illness, but also to try to ease some of that emotional stress that they're dealing with, and to kind of cut through a lot of that anxiety, so that they can actually have a better quality of life and not be so afraid, because that's exactly what happens when people do that. And then the other thing too is, sometimes on our palliative care team, our nurse will go with the patient to the physician visit. And the reason they would do that is to just help communicate to the physician what the patient and the family is concerned about. And this is a huge help, because oftentimes when medical people are speaking to medical people, they just have a certain way of communicating. And it's very intimidating for the lay person to go in and communicate to the doctor sometimes that they're not feeling good, or can you tell me why this is happening, etc. And so sometimes our nurse will actually accompany them to their visit at the doctor's office.
Mark, I did want to ask, and thank you for your honesty and how veterans feel. Do you think that the way veterans view their services, either positive or negative, has direct implications on how they view their illness or disease, especially if it's related to their service?
Well, veterans are I would say different in a sense, especially if they're combat veterans, because like my counselor explained, that trauma is different for everybody. So being in the military, it's a different culture. So sometimes like we'll joke around at the office, like I might have like a bad mouth because the F word is thrown here and there. So we have to tell our staff, hey, kind of tone it down, because if somebody walks in, they might not understand that that's how we talk in the military. So just like being able to relate, like learning acronyms and stuff like that. The veteran may view the government as, the military didn't take care of me, and what are you going to do for me? So they, like I said, they may think because we're a government agency, there's a lot of red tape. Yes, there is. I'm a veteran myself. So what RCS did was they hired people like me for the first Persian Gulf War, because when the Vietnam veterans came back, they did not get the care they needed. It was a bad time to even be in the military. They were saying, you're baby killers, this and that. So the stigma for Vietnam vets was very harsh. So for them, being proud of their combat wasn't a good time. So they carried that on, and they had this bad taste in their mouth. So when the Iraq war came out, we were praised. When we came out of that airplane from Texas and came back from Iraq, they were shooting our planes with water. We're like, oh my God, are this plane on fire? They're like, no, they're greeting you. They're so proud that Texas is so proud that you guys came back from combat. We had a standing ovation going through the airport. The Vietnam vets didn't get that. So for us, when they say, thank you for your service, we're like, you're welcome. But for the Vietnam vet, when you say, thank you for your service, it's like, oh, kind of late, yeah? Only now you telling me? So it's like, it's kind of like that. Well, we were praised and they were not. So now the stigma is, what did you guys do? So just comparing that, or being kind of like having that bad taste in your mouth. Some veterans had to go through a lot just to get their disability. So Congress And the VA is trying to be more sympathetic or hearing them more, because like I said, the combat veteran is different. If you see a car accident, there's maybe 5 witnesses, maybe one person has PTSD from that experience. But for a combat vet, they only had fight or flight. There was no such thing as freeze, so they're always going to have that in the back of their minds. So they may still always have that startle reflex. Like if I hear something, bang or have a loud noise, I'll be like, who got hurt? And it's like, nobody, Mom. The cup just fell on the floor. And I'm like, well, you don't understand. If I hear a big boom, it's because I think somebody got hurt. So it's the new norm for veterans. So just being able to have that readjustment phase to understand that the combat veteran is not different. They're not weird. They're not, mentally ill. They're just brought up and trained that way. Even if they wasn't a combat vet, just being in the military causes them to have high discipline, morals, integrity, that kind of stuff that the military instills in you. So, having that different outlook for that person, they're a veteran. So when you see veteran, you expect a lot of things out of them. And that's where it kind of goes both ways. It's like, yes, we're a veteran, but we're also people too. So, just to kind of relate to that. So when they walk in the door, they don't feel like, it's different. Because if they go to the VA clinic, they may not have somebody who was even in the military. So for veterans, they go to the VA clinic, they talk to a mental health, they say, what do you mean? You don't understand? You was in war. And then they walk out the door. So just trying to get them back in to the mental health to talk about, their experience. And maybe that person who wasn't in combat, it will be more sympathetic. Whereas a veteran who was combat can say, you know what, just suck it up and drive on, So it's like, okay, so which one are you going to choose, especially when it comes to benefits? A lot of veterans are just seeking the money for getting compensated for their injuries. So if they're not getting their 100% and buddy on the left is getting it, how come not me? So that's where we kind of help with, hey, what is it that you disclose? Where's your medical evidence? Here's a representative who could help you, so that they don't come in already mad. They can kind of come in and go, oh, I didn't know, calm them down and say, okay, let's start and see where you're at. And we can help you to get where you're trying to get to or where you're going.
I absolutely love that. Thank you so much, Maricar. There's so much access to support, but like you said, it's hey, come in, tell us what you need. We'll help you, direct you anywhere we go. That is so awesome to have in our community. So thank you. Back to you, Lonnie.
Thank you so much, Maricar, for letting us know too about the different types of vets that you're having to deal with when they come in. It makes so much sense.
Yeah.
I wanted to share that if there's any of them that don't have the advanced healthcare directive, I don't know if you guys do it there, at the center, but we have a group with, right here that can help with Community First Hawaii, that they do it for free. If there's any vets or spouses or anyone in their family that's 18 years or older, they will do these at the ADRC right on Kino'ole Street, and it's free, and they can just RSVP. So this is the information right here. When somebody is on any of our programs, we will do the advanced healthcare directive for them. But if not, we are really happy to refer people to Community First Hawaii to take care of that for them.
Well, sounds good, because like I said, we're a counseling center. So anything to do with benefits, we have them see Reggie at the benefits office, which we have to make an appointment through the internet to see him. And I heard he's retiring, so hopefully we don't lose him. But then, and we can get him replaced right away. If not, then they go to the healthcare. So like I said, the VA is a big entity. They got the healthcare, the cemetery, and the benefits, and we're a side branch. We're counseling. So just trying to get them to the right department. If they have any healthcare questions like that healthcare directive, I'm pretty sure the VA clinic can help assist with that, or the social workers. But now, because you guys are a resource, I say go to Hawaii Care Choices, and they can refer you to everybody else. Because I used to either refer them to, if they're elderly, to the Office of Aging. If
Mhm.
not, if you don't have VA medical, you would have to go through your own doctor, and hopefully they can have a social worker. If not, then I don't know the answer to that question. So basically, I'll just say I don't know. If I don't.
So we will email you the flyer for this Advanced Healthcare Directive team, and you are welcome to distribute it every place that you think it could be helpful. Thank you. And then now, in transitioning from palliative care, the palliative care umbrella is very, very large. One of the subsets for palliative care is hospice care. Hospice care is a very specialized type of care as well. It is, that's why when people will say to me, oh, well, no, my mom doesn't need hospice, or my dad doesn't need hospice because they don't want to give up. I want you to know that hospice care is actually a type of care. It's medically directed comfort care. And so, no, people are not giving up when they choose hospice. They're actually choosing a certain type of medical care. So this is really important information when people are talking to others regarding going into hospice care. And when we were talking about concurrent care, what that means is if there's a vet that has, or even a spouse that covers a vet that has Medicare, they're able to come on hospice care and receive all of the benefits and still keep their treatments under the VA insurance as well. So this is something that's exclusive really to those who work with the hospice program. So I just wanted to let you know that that's how it is possible for vets to receive all of the benefits. And believe me, when it comes to hospice care, it is a Cadillac of all healthcare services. It is the top of the line where they get everything provided to them. So if there are any vets that have Medicare, or maybe their spouse has Medicare that covers their husbands or wives, however that is, if they decide that they would like hospice care, they can elect for it and still keep their VA insurance coverage and continue to have treatments as well. So that isn't something that's offered to anybody, but it is offered to the vets, and we're very proud to be able to do that. And when people come to hospice care, it's normally because there's no curative treatment for them. So then they choose the medically directed comfort care, because when I ask patients or their families, well, what do you want for your loved one? The bottom line is always, I don't want them to suffer. I want them to be comfortable, and boom, that is exactly where hospice care comes in. So, all of the medical equipment is provided at home. Any of the medications they need, connected to their diagnosis, all of that is included as well. The vet doesn't have to go to the doctor's office. We come to the home, and then we provide an entire team. So it's really a very robust program for anyone to elect hospice care if they're a veteran and they have Medicare coverage as well.
All right, there is our next brain teaser bell. I'm putting that right on the screen. How is palliative care and hospice care the same? Both relieve suffering, both can be delivered in patients' homes, both improves the quality of life for patients and their families, or all of the above. Mahalo to those watching on Facebook Live. You will not be able to see the polls pop up, but we still want to hear from you. Put it right there in that comment box. How do you feel palliative care and hospice care is the same? Everyone can visit www.hawaiicarechoices.org/healthcare talk story and sign up for the fully engaged Zoom presentation the 10th of every month at 10 o'clock. All right, I'm going to end the polling right there and share your results. 100% of you said all of the above. Absolutely. Thank you so much for engaging in our polls. And I'm going to go right back to you, Lani.
Thank you. And with regard to how palliative and hospice care is paid for, so palliative care could have a copay depending on the kind of insurance a person has. So for the VA, all of the palliative care is pretty much right now provided by the VA. And then again, on hospice care, what I was sharing is if there's a veteran that is currently receiving benefits on the VA side, if they also have Medicare, and some of them do, they can elect for hospice care benefit and receive all of those benefits in advance. Know that VA has a hospice benefit as well, but a lot of times when vets are also receiving treatments, they don't normally elect to get hospice care, but I want everybody to know that they can. And it is at no charge to them if they decide to elect that, should they have a Medicare. And so that's how it's pretty much paid for at this point. If they're on VA, they'll be covered by VA. If they're doing palliative care, if they have hospice care, they'll also be covered under VA. However, if they're doing any treatments and they would like hospice care now, and they have Medicare, they can go ahead and elect hospice care, and they'll get that plus the VA treatment. So it's really quite exclusive just for the veterans.
Thank you so much, Lonnie, for talking stories with us about palliative care. Thank you so much to our audience for listening in this morning on Healthcare Talk Story, and a very special mahalo to our guest, Maricar Souza, for your valued time, helpful perspectives that were shared at today's talk story. If any of you have a specific situation or about you or your loved ones, or excuse me, specific questions about you or your loved one's situation, we do have a helpful team standing by that will be happy to answer your questions. You can give us a call at 969-1733. You can also email us at care@hawaiicarechoices.org, or ask your doctor if palliative care is right for you, because our hope is that you receive the right care at the right time. For those of you joining us on Zoom, there will be a quick survey that will pop up on your screen. Please make the selection that you feel is best for all 6 questions and submit the button below. This is anonymous and it will not be shared. We would just love to get your feedback on our presentation today, because your feedback helps us to better understand how we can best serve you with presentations like these in the future. Lonnie and I do read through them and we do take them all into consideration. So we hear you. For those of you on Facebook, please send us your thumbs up and your hearts if you enjoyed this presentation, and send a mahalo to our guests. You are all invited next month to the Fully Engaged Zoom presentation coming up May 10th at 10 o'clock. Mahalo so much. That survey should be launching on your screen right now. All right, Maricar, again, thank you so much for giving us your valuable insights. Thank you again for your service and your helpful in, behind the scenes, even as a veteran and what they go through, but also the access to care and the resources that is available. While they're doing their surveys, if I could ask you, how do you feel our veterans here are coping with serious illness, isolation, or trauma? I know you kind of touched on that a little bit, but we want to hear just a little bit more.
Well, as far as being able to tell their experience, it's all case by case, depending if they just lost a loved one. We do provide counseling for combat veterans and their families, but also with military sexual trauma and bereavement counseling. So depending on what they're going through, then either I could talk to them, but if it's higher than my degree or my knowledge about counseling, then I'll refer them to our counselors. Even if they're not combat vet, we can still talk to them. So we even talk to teenagers, experience anxiety, depression because their mom or dad was deployed, or just going through stuff. We can do the basic care, but we're not psychiatrists or psychologists. And I don't even know on a personal note what the difference is. All I know is that one medicates and one doesn't, but it all depends on the person counseling, if they're empathetic or compassionate or trying to hear them. Every counselor is different, because one thing we learn at the vet centers, we don't want to project, or we don't want to, tell our stories more than theirs. So we do have team building every Wednesday. So whoever is trying to get a social work or psychology degree, our boss, former boss Felipe and our boss now Denise, will go through that, like self-care first before you help somebody else. So if they're experiencing something, Like I said, it could be as minor as, I cannot get my driver's license to say veteran and I'm pissed off. But the other vet is like, hey, I just lost somebody. I'm sad or pissed off. So it all depends on the situation, how that person is reacting. We have some people with very strong mental illness, and we know that they're either on drugs or probably just not on their meds. We have to refer them to the clinic because that's above our level. Like I said, we're not psychiatrists or psychologists. If we find they're suicidal, we have to send them to the ER. So it all depends on what the situation and they come in for. We are trained to at least do the basic, first aid for suicide. All of us are required to at least do that. So we have the basic skills at least to help them initially. After that, if it's too much for us, then we'll refer back out. And I had there's a couple questions that was sent to me personally on this, and it said to answer the question live. Are you guys tracking those questions?
Yes, I am. So let me just go ahead and get in that.
I didn't know.
Yeah, no problem. It's okay. Does the VA offer in-home care assistance and or personal care attendance? And who do we reach out to?
Well, they have like the caregiver program and aid in attendance. So aid in attendance that I know of is they supplement your income by giving you an extra $1,000 on your disability check to hire somebody to either care for you in a home or being in a care home. So that is a separate benefit that they would have to fill out the aid in attendance by their doctor to be turned into the benefit side. So I just refer that straight to the clinic or to Kevin and let them handle that part. So we can print out the application, but that's as far as we'll go because we personally don't fill out applications because if something was wrong, the veteran will say, I didn't get the benefit because of you. It's like, well, that's why we don't fill out applications. They had a program just recently where they're trying to see if they can have a section in the VA that does that specifically. So they came, I think it was in March. It was the VEAC event. I forget the acronym stands for, but it was a team from, way up as Congress came in and what they did was they answered any questions about applying for benefits. So whether it was healthcare, and they actually did the application and had the benefits and the healthcare on standby on the telephone to answer those specific questions. So they're trying to see if they can get one of those people on the highest level to come in and be stationed at a vet center where they can do that and have access straight to the benefits and healthcare to help answer any questions that they need just about applying. So hopefully there's a position coming in the future, but the government hears the vets and is trying to accommodate that because like I said, there's barriers, even just applying and understanding what they're applying for. Because even if they apply for healthcare, they may have to pay copays, depending if they're a combat vet or was exposed to environmental agents. That's why the PACT Act came into play. So now Agent Orange vets or Persian Gulf vets are getting their claims expedited because they're becoming more sick as they live longer. So even for myself, I just found out because I'm a Persian Gulf vet, my asthma went from asthma to bronchitis to now I might end up having COPD or emphysema because I was exposed to those burn pits and sandstorms. So just by being there, breathing the air, we can become sick. So there's a lot that veterans need to know. Like the PACT Act is being mentioned in the news, but what does that mean? So I can help kind of buffer that and go, hey, there's a brief that the benefits host once a month that you have at least 3 or 4 benefits counselors that have 100% of your attention. Go ahead and bombard them with all these questions because that's what they're there for, is for your benefits. Healthcare, we can call, like I said, the VA clinic directly, or you can even email the VA director if you need an answer, quickly. Why I can't be seen by a doctor for 3 months? What's the problem? So, like I said, if I can get a hold of them directly, that makes the veteran feel like, hey, we're doing something instead of just waiting around for the answer.
That is so wonderful. Thank you, Maricar. Well, first of all, I'd like to say again, thank you for your service. I think a lot of us civilians don't realize that there are long-term implications for your service. So really, when we're saying thank you for your service, it's your longevity, your life that you have given,
Mhm.
and your health in that too. So just it's a deep thank you. And I'm hearing if anybody has any questions, please feel free to call Maricar and her team. They're at the vet center. If they can't help you, they will get to somebody or get you to somebody that can help you as well. So appreciate it. We are at 11:02, but I have one question just for Lonnie. I know a lot of people are asking about this. Lonnie, can you tell us if Pohai Malama will be reopening as a inpatient hospice facility?
It looks like there are plans for Pohaimolama to reopen. At this time, I don't know in what way it's going to open, like exactly who we will be serving. There's several scenarios that are going around, but the number one thing we have to do first is we have to fix the air conditioning. And until we do that, then we'll be able to open again, because the safety of any of the patients that go in there is number one to us. And so the way that building is built, it has to have this special type of air conditioning where the air actually is reversed out of the room, so that even if there's any kind of airborne pathogens, there is no illness that continues through the halls. So it does cost quite a bit to get that sophisticated system, but fear not, it is on the board, and we hope to reopen sometime later this year. So stay tuned.
Mahalo, Lottie. Mahalo again, Maricar, for all of your information. Thank you to everyone who joined today's talk story, both on Zoom and on Facebook Live. If you feel that you've benefited from this presentation, please let your friends and family know they're welcome to join us. It is the 10th of every month at 10 o'clock. Just RSVP to myself, or you can find the registration on www.hawaiicarechoices.org/healthcare talk story. Mahalo again for joining us. See you next month. Ahui ho, malama pono.
Thank you all.
Aloha.